is I'm willing to bet that you have never heard it really explained as to what those things really are and how they really work. So we're going to try to put it all together for you. And why is this a big deal? Well, they say that we have the most advanced healthcare system in the world, and that's arguably true. But are we actually getting health out of that healthcare system? That's the question. Well, let's look at some statistics. We spend just over $2 trillion a year in healthcare, and yet when we look at how well we're doing health-wise, we rank 37 out of 39 countries on the industrialized list. And most of what they do is they give us a bunch of drugs and they say that, well, you have this symptom, you have this problem, so go ahead and take this drug and that'll get you better. Well, if it actually got you better, then you would take the drug, you would get better, and you could stop taking the drug, right? Well, that's not really how it works. You got to keep taking it for the rest of your life. So drugs aren't really a measure of how healthy we are, they are a measure of how sick we are. And in this country, we have 5% of the world's population. We take 55% of the drugs. And we spend $2 trillion doing it. So we're going to talk about why this is and what the reasons are and what we can do about it. They have estimated that there's about 1 million deaths per year that are due to the healthcare system, due to medical care. That's the #1 cause of death in the country, and that's a huge, astounding number. But if you break that out, that's the same as having 7 jumbo jets crashing with no survivors every day throughout the year and next year. And that's just the United States. Do you think there'd be any planes taking off tomorrow if that happened today? And yet we keep going to the hospitals, we keep going for more meds. So that may not be the way to go. And then there's talk about healthcare reform, but healthcare reform, it's not a question of whether the system works, it's just trying to get more people access to the system. So I think it's a good thing that if you break your leg that someone takes care of that, that's wonderful, but we need to look at the overall picture of the healthcare system. So why has it gotten this way? Why is it this way? And it's because we have the wrong model. We don't understand the human body, we don't understand health, and we don't understand the real reasons for why things go wrong. And here's one of the main reasons. We're treating symptoms, we're not addressing causes. And if you have something like pain or high blood sugar or arthritis or anything else that's a symptom or that's a problem, all it means is that there's something that isn't working right. And if that thing that's supposed to work was working, you wouldn't have the problem. Make sense? But there is no drug, there's no pill that you can add to the body and make that thing work again. So what drugs are doing is they're just covering things up. They're not addressing the source of the problem, and it's not making anything work better again. It's sort of like the fire alarm goes off and you put in earplugs. Are you fine now? No, the building's still coming down. All right, you just don't know about it until it's too late. If you're driving down the road and your gas gauge says you're running out of gas, you can put a piece of tape over the pesky little thing and then you can't see it. You're still going to run out of gas. And if we keep ignoring indicators, the problems will always get worse. They not that I know of that they ever get better. So it's not that drugs are a bad thing, it's just that we have to know when to use them. They can be lifesavers when there's emergencies and acute pain. If I break a leg, I'd like for someone to give me some drugs and put it back in place. But when we use drugs for chronic conditions, that makes no sense at all because we're making it worse. So when we're talking about that thing that's supposed to work, that isn't working when we have a problem, what is it that's supposed to work? Well, in the body, when we talk about what's working, we're talking about function. And there's 3 levels of function in the body. And the first level is passive tissue. These are things like bone and cartilage and connective tissue and fluids and fat cells and blood cells. They're all important. They give the body shape and structure. But in terms of function, in terms of action, they don't do anything. Then there's the active system, and that's your muscles. So that's your voluntary muscles to move around. It's your postural muscles. It's your heart. It's your intestinal tract. It's your eye blink. Even your blood vessels have muscles they can contract, so that when they contract, your blood pressure goes up. When they relax, your blood pressure goes down, because that's a normal mechanism in your body, so that your body can choose what to do in different situations. But even though muscles perform all the work in the body, they do everything in terms of moving things around, they don't make any decisions whatsoever. None. They only contract when they get a signal, and they relax when the signal stops. So when we talk about function, we're talking about the regulatory system, which is the brain, the central nervous system, and all the cells called neurons. So if we truly understand this system, then we see that the passive system, that's a tertiary system. It's 3 levels removed from where the function is. And if you think about it, if you go and you get a diagnostic test, a medical test, that could be an X-ray or an MRI or a blood test or a liver test or a tissue sample. All they're checking is passive tissue. They're only measuring effects. And these tests don't tell you anything about why it got that way in the first place. So it's not that they're useless, it's just that they're not telling us why it happened. And if we're truly looking for health and prevention, we want to know why it got that way. Muscles are also an effect. They're secondary, but the primary and the cause is the regulatory system. That's where all regulation and all function occurs in the body. So this brings us to a startling conclusion that if you get shot or stabbed, or you fall down the stairs, you're in a car accident, or maybe if you have some severe deficiency of vitamin C or proteins, you get scurvy or beriberi or something, then there is one cause, and it's kind of obvious. The thing hit us right there. That's where it broke. That's where it hurts. We know what the cause of the problem was. But outside of that, everything else is a brain problem. Everything else, because it's about regulation. Everything that's supposed to work is working because of how your brain regulates things, and that depends on how your brain interacts with the environment. So, has anyone ever experienced stress? A few? All right. And has anyone heard of or done a Google search on conditions related to stress? Like, oh, we're not quite there yet. All right, we'll get back to stress. So now I need a volunteer. Someone who's done eating. Come on up.
First, I want to know if you're any kin to Anita Ekberg.
If I what?
A kin to Anita Ekberg, movie star.
No, just by name.
Just checking.
Just by name. So, what's your name?
Liz,
Liz. Good to see you.
good to see you.
So, we're going to face each other and sort of face the crowd sideways.
Okay. Oh,
So, if you hold your arm out for me, nice and strong, and I'm going to push down on it, and I'm not going to push super hard, but I want you to lock that arm and make a really strong response. Hold nice and strong, okay? And that's nice and solid. And you can all come up after the talk if you want to have this verified, because some of you won't believe this. But if you think about what we just said about passive tissue, that's the bone, active tissue is the muscle, and regulating tissue is the brain. So when I'm pushing down and she resists, all three of those systems have to work, and they have to do their part. Now move your left leg forward like you're taking a step. There, and we're going to do this again. Hold real nice and strong, just like before. Okay? Did you notice the difference?
I sure did.
Okay. And I'm not pushing any difference.
Harder than you did the first.
Yes. So why would that happen?
Balance.
Nope. That's the first guess I get with everybody.
Her brain's thinking about the foot that
The brain's doing something different. Exactly. That's the first part. The bone didn't change. The muscle didn't change. It's the signal from the brain to the muscle that changed. So the muscle test, first of all, is not really a muscle test. It's a snapshot of brain function. If we do it like I just did, which I don't really care if you can resist 5 pounds or 50 pounds. I just want to see if it's working. So the other thing that we can see is that when you put your leg forward, that apparently changes something about how the brain does business with the arm. And in this case, it's very simple because I don't know many people that walk like this.
I don't.
So the brain is going to try to correct that, and it's going to say this arm is in the wrong place. It needs to swing back so the other arm can go forward. It's called a cross-crawl pattern, and we've all done it since we started crawling. And we've done it so much, it's one of the strongest patterns in the body. But it shows us a lot of good information. It shows us that a muscle test is about the brain. It shows us that the brain operates on input, on feedback. And that feedback, the information coming from the rest of the body and the environment, is what determines the sort of output that the brain produces. Okay? So we can check this real simple. If you put your left leg forward again and your right arm. Now, you're still sort of off balance, but let's check. Hold strong. And that's working beautifully. Okay? Now, we can just do real quick and check, what about the other way? So now, if you stay where you are, and you keep that arm straight, and I'm going to pull out, because this is the muscle that pulls it back, and hold strong. And that's not working so well.
Giving it all I had.
But hold strong. This one's rock solid. So it's a cross-roll gait reflex pattern. But think about this now. When I bill insurance, they do not allow me to treat an area where you don't have a complaint, because they don't understand these things. But we just showed that if you have a hip that is not sending the proper feedback to the brain, that can shut off your shoulder. So you can have a shoulder problem because someone hit you on the hip. And those are just a couple of body parts we mentioned. The complexity of the system is outstanding. You have 100 billion brain cells. They receive 1 billion bits of information every second, and every bit of that information has to be responded to. It always turns something on or turns something off. And the sum total of all that turning on and off, that's your health, that's your function. So thank you very much. So with that, we will talk about stress. Because stress is some of that input that the body has to process that turns things on and off. So if you look up a condition, conditions related to stress, you'll find things like cancer, hypertension, heart disease, diabetes, allergies, arthritis, pneumonia, headaches, back pain, fibromyalgia, chronic fatigue, ulcers, irritable bowel, chronic infections. There is basically nothing that's not related to stress. How can that be? How can something intangible, something nebulous like stress, have all of those detrimental effects on the body? How can it shut down and cause damage to all those things? And it comes back to brain and feedback. So, we're going to spend some time here. Here's a very all-inclusive illustration. This is your part of your brain. The cortex is the most modern, the most newly developed portion of your brain. It's the thing that looks like a walnut with all the folds. That surface layer is the cortex. It's the most unique thing about us as humans. It's the thing that sets us most apart from other animals. It's been developed mostly in the last few 100,000 years. Below that, we have the brainstem, and it doesn't really look like this, but I'm just picking a couple of places to help illustrate what we're talking about. The brainstem is the same in all mammals. The complexity is very little difference from a mouse to an elephant to a human. It is hundreds of millions of years old, and it deals with things like survival and animal instincts and instinctual behavior. So when we have stress, when there's stress in the environment or in emotional stress just inside us, we have chemical stress, structural stress, and emotional stress. The body doesn't care which one it is, it's just stuff that we have to deal with. And that stress sends a signal, and the first place that signal is picked up is in the brainstem, the primitive animalistic portion of the brain that deals with survival. And as a reflex, that brainstem, the sympathetic, which is the portion responsible for the stress response, sends out a signal to turn on that stress response. And first thing that happens is we start a cascade of things like you're increasing heart rate, you get an increase in muscle tension, you get an increase in blood pressure. And all of those things sort of make sense, because let's say the stress is a grizzly bear. It comes charging out of the woods and it's heading for you. Now you're going to need some heart activity to pump the blood to make sure that you can get away. The muscle tension, you get ready for fight flight, you're going to have some muscle get ready for action. Your blood pressure goes up because that helps the blood move along quicker. Then as the bear gets closer, your infinite wisdom of your body says, we're going to need lots of energy for this. So let's raise blood sugar. And there's a hormone called cortisol, which is a stress hormone. That primary function is to raise blood sugar. And while it's doing that, it's also creating insulin resistance. It reduces your insulin sensitivity so that you can keep that blood sugar up for action. And then you check out the claws. Bear's coming closer. He's got pretty sharp claws. So your infinite wisdom body is saying, there may be some bleeding before this is all over. So just in case, I'm going to start preparing, and I'm going to increase my blood clotting factors and make sure I can close that wound quickly if it happens. And part of that wound clotting is cholesterol. It's one of the most important components both in blood clotting and in wound healing and tissue repair. So does this ring a bell? Does that look like anything people take medication for? That's about 80% of the top-selling medications. It's high blood pressure, high cholesterol, blood thinners, and diabetes drugs. And so far, we're only a few seconds into this. We haven't eaten anything, we haven't done anything. All we did was observe a bear coming charging toward us. That's what stress does. And because the body has limited resources, all the resources in the body are carried by blood, and every one of us has about 1.5 gallons, so there's only so much to go around. So if you send all the blood over to these places, then you have to borrow from someplace else. You have to shut down some other things in order to make all of this available. So the stress response is hardwired to turn off the relaxation response. And what does the relaxation response or the parasympathetic do? Well, it only does some random little things like digestion, immune function, reproduction, healing, and DNA repair. Those seem like pretty important things, don't they? Those are the things that keep you alive tomorrow. Wouldn't that seem like a pretty stupid thing to shut that down? Well, we're not really concerned about tomorrow yet, because there's a bear, right? So that's the way the body works. Whenever there's a stressor, there is a potential threat to an immediate threat to your life. And for the survival value, you're going to shut down everything that can't help you survive that bear. If it doesn't help you fight the bear, it's not important right now. So your digestion and your immune system and all of those things, they're going to be put on the back burner. Okay? Now, it seems like we're screwed, doesn't it? Because here's the environment sending these signals, and we're hardwired to turn on all the stress stuff and turn off everything that keeps us alive till tomorrow. So there's got to be a way to break this cycle, and there is. And this is where the cortex comes in again. The cortex is our awareness. It's our higher functions. And the cortex is wired. It has the ability to, when appropriate, to turn off the stress response. So if there's a bear actually coming at you, that's not a good time to turn off the stress response. But if you realize that, hey, there's nothing to be stressed about, then that's a good time to turn it off, and then the cortex will do that. Here's the problem. The more stress we have, the more the balance will be shifted away from the cortex to the brainstem. This has to do with blood flow also. That when we have stress, the blood flow goes from the cortex to the brainstem. That's why the more stressed you get, the more stupid you get. Have you ever been really flustered and you can't think of anything to say? There's this stupid person in front of you and they need to hear it and you can't think of a single thing? And then it comes to you later? Yes. That's because all the blood went away from your cortex and down to your brain, down to your brainstem, and you were getting ready for a fist fight instead of saying something clever. All right? And so the more stress we have, when we have chronic stress, when we get into patterns of chronic stress, which we basically all do, then the cortex suffers and the cortex loses blood flow and it gets weaker because of it. So how do we get the blood flow back to the cortex? How do we ramp up the cortex again? And now we have to understand something called use it or lose it. This is the most important, or one of the most important principles in your body. Use it or lose it. You have 50 trillion cells, give or take. Every one of them you have for a reason. Your body doesn't keep cells around arbitrarily. If you use them, they're going to get another chance. If you don't, they're going to get flushed out and replaced by something that you do need. So when you go to the gym and you do some biceps curls, you're putting some tension on that biceps. That tension is a signal to make a bigger muscle. Use it or lose it. Then if you hurt that arm, you put it in a cast, then that muscle atrophies, and it does so very quickly. Well, the same thing holds true for every cell in your body. Muscles we sort of understand because we can see them. The brain we don't understand because it's hidden away. How do you use your brain then? What does the brain do? It processes information. It receives information from the environment, and by the time it gets to the brain, it's in the form of electrical signals. So all the brain really does all day long is to process electrical signals. And the more of it the brain gets, the stronger the brain gets. The less it gets, the weaker it gets. That's what degeneration is. That's where Alzheimer's comes from. That's where all degenerative diseases come from. The only problem is we don't understand much about how the brain, or until recently, how the brain works. Most people say, well, to use your brain, you need to do crossword puzzles and play bridge and stay mentally active. And that's not a bad thing. It's just that that's only a tiny, tiny portion of your brain. That's a conscious, intellectual portion of your brain. That's actually about 1/1,000,000th of what your brain does. So doing crossword puzzles, you keep that 1/1,000,000th really strong, which isn't bad, but it's not doing much for what we're talking about. Turns out, 80 to 90% of what your brain does is to process information related to posture and movement in a field of gravity. That's the most important thing there is, because if you can't do that, then you'll fall down, you'll hurt yourself. If you don't know where your body parts are, you'll lose them. So the majority of what the brain does is to process that kind of information. And the brain gets it from two places. It's from muscles and joints. Muscle spindle cells and joint mechanoreceptors send information to the brain so you can do amazing things like that on a good day. So muscles and joints send information to the brain. And this seems like a trivial thing, but this is the majority of the stuff that keeps the brain alive. And where then do we have the largest number of muscles and joints and receptors in the body? If you had to pick one, throw me some guesses.
Feet.
Hands are a good guess, but not quite.
Feet.
Nope. Nope.
Back.
Back. Back and neck especially. Back provides the majority. The back spine has 25 or so movable segments. There's 3 joints per segment. There's a dozen muscles. There's hundreds of muscles in the spine. Not only that, but that information is so crucial to the brain and to your organism because your spine is literally the backbone. It's the foundation around everything that you do. And then on top of it you have your head, and so the neck, which has to integrate all that information, is as important in terms of information as the rest of the body put together. So that is where most of the signals come from that stimulate and keep the bulk and the strength of your brain alive. So does it sound like exercise is a good thing? Okay. And you don't exercise to lose weight or for your heart or for anything. Those are trivial side effects. You exercise to keep your brain strong. When the brain works better, everything works better. All right? So where does chiropractic come into this? Well, first of all, chiropractic works because we have the greatest input on the brain by addressing joints in the spine. It's not the only place we do work, but that's where we can make the greatest differences in the brain. But let's say that these bones are moving like this, and that movement sends a signal to the brain. Has anyone ever been hurt? Ever fallen down? Ever sprained an ankle? Been in a car wreck? Slept wrong? Okay? So if there's a little glitch somewhere where it's supposed to move like this, but instead it moves like that, what happened to the signal that's supposed to go to the brain? It's going to be altered. It's going to be less of a signal. As a result, I kid you not, that brain is shrinking. Not as dramatically as we're showing here, but it is shrinking. Literally, physically, absolutely. So the job of chiropractic, because if you do exercise on this, it will benefit you. You will send more signals on both sides, but you won't clear the imbalance a lot of times. Sometimes you will, but by the time you have a few hundred of these, which we all do, then the body is not going to be able to clear all of that on its own. That's where chiropractic comes in. When we clear out that problem, we restore that motion. Now, with the proper motion, we can get the proper signal. The proper signal can start rebuilding the brain, and now we have a system that is capable of responding the way it's supposed to again. That's why chiropractic works. And if you take a brain scan before an adjustment, you see the amount of squiggles here is the amount of brain activity. And after an adjustment, there is a change. And it's not about moving a bone. It's not about a bone out of place. It's about what happens in the brain, what happens to the feedback and the processing ability of the brain afterwards. So the brain works better. Pain relief is just a bonus. So what fits your busy schedule better? Exercising an hour a day or being dead 24 hours a day? That's unfortunately what happens a lot of times. We get caught up. We need something really dramatic, something life-threatening, a wake-up call before we do the stuff that we're supposed to do all along. So instead of talking symptoms and disease, we want to start talking function. If you have 100% function and processing ability in your nervous system, that's the best health you can have. The worst health you can have is 0% functioning. That's called dead. And if you have one live person, you have one person that fell down dead 10 seconds ago, they both have a body, they both have muscles, they both have blood sugar, they both have a skeleton. We can run x-rays, we can run MRIs, we can take blood tests. They're going to look pretty close. And one's alive and one is dead. What's the difference? It's their processing ability. The dead one doesn't have any more signals. It doesn't process any information anymore. So what we want to talk about, rather than symptoms, is how, regardless of where along the scale we get a symptom, let's just do all the things we need to do to get the function up to as close to 100 as possible. So here's the cause of disease. It's distorted input, the improper feedback from your body and inappropriate processing, improper stress responses from the environment, and nutrition, lack of proper building blocks. If you have this, you cannot get sick. What's required for health? I love this one. You take a plant and it's not looking so happy. What do you give it? Water. Water. Okay. You gave it water, it's still not so happy. What's next? Sunshine. You do those and it's still wilting a little bit. Nutrients in the soil. Check where it's growing. Yeah. So a 5-year-old can tell you these 3 things. And these are requirements for health. They're not suggestions. They're not stuff that you do on a good day when you have the time. They're requirements. If you take 1,000 plants and you give them 2 out of 3 for a couple of years, how many plants do you have left? 0. Because if something's required, you gotta have it. You can get by for a while, you can get by for a few weeks, humans can get by for decades. But if you're talking optimal function, you gotta have all 3. What do humans need? Nutrients, movement, and purpose. How do we do that? Eat better, move better, feel better. And feeling better is a skill. It's something that you can learn. You don't wait around for the world to look the way you want it before you appreciate it, because that's going to take a while. You practice appreciating what is. So that's not the topic for today. We don't have time, but this is essentially it. So There are some appendices. I thought some of this was going to be printed out, but if you like a printout of this, I'll be happy to email that to Aaron, and you can get all the notes for this plus some appendices to help explain some of the things. So this concludes what I had to say, and I'll be happy to stay around for any questions or demonstrations or anything at all that you'd like to do. So, thank you very much.
Thank you.